All right. I am so excited to be doing this Visual Health Live, and I have gotten some really great questions sent in ahead of time. And all of you who join in, be great to have you write your questions over in the chat, and I'm going to try to get to those also. Let me see if I've got the chat on here. I think I do. So, in this discussion, what I really want to get to, because I've had so many questions regarding macular degeneration, cataracts, floaters, dry eye, blepharitis, chalazion, all sorts of, ocular topics. And I want to try to get to as many as I can. And I'm going to bring up one of the main things that across the board through the question boxes I've put up that came up is, will carnivore help my glaucoma? Or my dad's got macular degeneration. Will carnivore reverse that? Will carnivore help my nearsightedness? I mean, over and over, the questions are pretty much asking, will this change in diet help all these ocular conditions? And obviously, there's no studies that nobody's going to put out a couple $1 million to do an appropriate study to determine exactly if this, let's say, keto carnivore way of eating is going to reverse any specific ocular diseases. Because you'd have to take like 1,000 people, put them on like a keto carnivore way of eating, and come back a year later, and number one, you don't know how strictly people adhere to it, but then determine if there was a change. So it's very, very difficult to specifically answer people in their seeking to figure out if carnivore way of eating is going to help. So um, on the topic of macular degeneration, because I got so many questions regarding that, I have some, I'm not enough savvy to have a share screen and all that now. So I'm going to do it more of a primitive way and just hold pictures up. But I just wanted to go over a little bit about macular degeneration because that was one of the most asked about topics. And it's so prominent. There's 1 in 3 people now over the age of 75 have some macular degeneration, and it's the leading cause of irreversible vision loss and blindness in people over the age of 65. And there's 1 in 11 people over the age of 50 that have macular degeneration, and 20,000 people each day are diagnosed with macular degeneration. So it's pretty much at like epidemic levels. There's so much evidence that it can be halted and prevented. So much. I've done a lot of research into this, and I'm convinced 100% that there is a diet-related way to prevent it or halt the progression of it. I'm not so sure about reversing it because of the fact that once some scarring's done and once it's gotten to a certain level, I'm not so sure that damage can be reversed. But the really good news is that it's really preventable. And, people who have a family history, you have to think about it. It's just listen to what I'm saying. You're not doomed. It's caused by processed food consumption, and it's not age related or caused by aging or genetics. Let's just say genetics play a role. I'm not going to discount that it doesn't play a role, but the environment pulls the trigger. So pretty much the food you eat, and whether you're smoking or not, smoking is another big, factor in it. But I really think that aside from that, the just say the genes load the gun, but the environment pulls the trigger. So by the issue really is that in 1880 was really the start of processed food into our whole food system. And it wasn't until about 1911 when Procter and Gamble came up with trans fats that that was introduced. And exponentially, there has been so much disease. Um, and it really comes down to uh, understanding that no matter what, not just eye disease, but heart disease, stroke, cancer, arthritis, mental disorders, all so related to this food of modern civilization. You know what? I'm going to show you just so you get an idea. So I'm going to show you the picture of a normal back of the eye. So this dark area right here, that's the macula. And then over here, I don't know if you're getting a glare. It's probably not. Um, that was the optic nerve. And macular degeneration, let's get a picture of that up. Here, this is a good one because it shows a normal retina on the top, and then on the bottom, you see where all these drusen are, that is macular degeneration. There we go. That comes up much better closer. So that once that's happened, that's what I'm not so sure is reversible. It really does rob you of your central vision. So um, the most important thing is avoiding seed oils. So if I could pass along one tidbit of information of everybody who's asked about trying to prevent this or help somebody, a relative or a friend who has it, it's avoid all of those seed oils. It increases your risk of macular degeneration by 4 times, a fourfold increased risk. So that's number one. Just instead use butter, ghee, bacon fat, beef tallow. The other thing is no high glycemic foods. That will also increase your risk. So eliminating grains and whole wheat, pasta, all of that. And of course, sugar. So sugar, grains, and seed oils, processed food, get rid of that. And I feel like we could make a huge difference in the amount of macular degeneration that is happening now. So there's about 15% will progress to a wet macular degeneration, which those are the people that will need injections. And the injections are really just to try to halt the progression. It doesn't cure it. It doesn't reverse it. So it's still an issue, even though the dry form, which is that the drusen, that picture I showed you. Let me pull up a picture of once it goes to the wet form, and it's called wet because of the bleeding, and you can see all the blood that's in there, and that's a big problem. Let me go over into the chat just to see. Thank you all for joining. Is there anything that can be done for a lazy eye in older adults in their 70s? So that's hard to answer, not being able to really know more specifics, but a lazy eye is typically something that is had from childhood, either from an eye turn or from an eye that's called refractive amblyopia, where that eye is lazy because it had a very strong prescription in one eye and clear vision coming in the other. The eye with the prescription that was not corrected for a while until it was discovered becomes lazy. And the term lazy just meaning it doesn't develop. The vision does not develop. The connection with the brain to the eye is you have to have clear vision by the time, you know, 9 to 12 is pretty much the cutoff. If it hasn't been discovered and treated prior to the age of 9, the chance of a lazy eye improving is very slim. So if somebody's had a lazy eye their whole life and now in their 70s, I'm going to say no, that's not going to be corrected by a keto or carnivore way of eating. There are a few things that I'll have to say are I like to say the body's remarkable at healing and can heal just about anything, but I'm pretty confident lazy eye, since I know a lot about it, and that it needs to be really treated at a very, very young age, because that's when the visual development happens with the brain. Okay, let me see. Hi, Dr. Lisa. Every time I try the carnivore diet, my eyes get really dry. Do you know what causes this? Salt and electrolyte intake is fine. Well, that's interesting because I've had so many people reach out to me to give me their testimonial of how their dry eye resolved with eating this way. So I'm not sure if you might potentially, I don't know how long you've been into it, but it could be oxalate dumping, because that typically does happen if you follow Sally Norton's information. A lot of that comes through the lids. And, you know, since we're on that topic of dry eye, since I got a lot of questions about that and blepharitis, I'm going to show, so one of the questions was the person wrote in, they're looking to cure their constant bloodshot eyes, and their doctor had recommended Lotemax drops. So Lotemax is a steroid, and I, as an eye doctor, in all my 30 years, I have really always tried to discuss root cause problems, and I am not quick to prescribe a drug to mask a symptom. And the question here is, why do you have constant bloodshot eyes? There's got to be a reason for it. Is it allergies? Is it infection? Is it blepharitis? Is it dry eye? Figuring that out is what's needed to get rid of the bloodshot eyes and not mask it with Lotemax. Lotemax, being a steroid, is an anti-inflammatory, so it will temporarily work in the short term, but it's not a long-term solution. So where are you at that point? Like, really, like, are you just going to refill the prescription and keep throwing more steroid? And then you have the added problem, you cannot be on a steroid long-term. Steroid has a issue with it, a side effect of some people are what's called steroid responders, and the pressure in their eye will go up responding to a steroid drop. So it's not a long-term drop. So where are you at if you're not getting to the cause of the red eye? So now I'll go into, as far as dry eye and meibomian gland dysfunction and bloodshot eyes. I do feel, because I've had a personal experience with one of my own patients, aside from other people writing to me and expressing their improvement with blepharitis and dry eye. I've had a patient who had pretty severe blepharitis who was willing to actually listen to my little side discussion with them about the way he was eating, and discussed a potential change to this real animal-based way of eating. And he switched his diet, and 6 months later showed up at a meetup, the first annual Northeast meetup I had here, right at this table that I'm sitting at. He, was one of the 8 people that came that first year, and said, "Do you remember me?" And I was like, "I kind of recognize you." And he goes, "Yeah, I'm your patient. And, I lost 30 pounds doing what you told me to do to treat my eyes," which is awesome. And he said, "My eyes feel great." And so I know firsthand that that was the change that was made, and he was willing to do it because he had motivation at that point. He was miserable. His eyes were red and inflamed. So I'm going to go into the reason why I really do feel like the proper diet of an animal-based diet is effective for that. So in our lids, upper and lower, I'm going to pull my lid down. So in this area here, I'm going to show you now this picture, which is a special photography showing the meibomian glands that are running, trying to get it so it's not a glare, that are running in the lids. And each of those glands has an opening right at the edge of the eyelid margin. And those glands are there. The meibomian glands secrete a type of sebum, an oil. And the eye is such a remarkable, I mean, the more you learn about it, it's pretty incredible how it works. So I'm going to show you the next picture is you can see a little droplet all lined up there like little soldiers. And that is, trying to see, trying to kind of get a glare, but the droplet is coming out of the end of those meibomian glands. And that happens on the upper lid, the lower lid. And when we blink, those oil droplets are then pulled and dragged out to be the outermost layer of our tears. Our tears actually have 3 layers: a mucin layer against the eye, then an aqueous layer, which is that typical, what you think of as the watery tear. And the outermost layer is that oil layer, which is there to prevent the tear from evaporating really quickly when we hold our eyes open long enough to be able to see in between blinks. So what happens in a standard American garbage diet is the sebum changes into a very kind of thick, you can see it, a thick, cloudy little dot on the edge of the lids, and that is not spreading nice and fluid over the eye to be the oil layer to prevent the evaporation. And then what happens is I'll go into then the, aside from dry eye, because now your oil layer is not sufficient. You have an aqueous layer that as soon as you're opening your eyes, it's evaporating because the oil layer is not protecting it to stay covered onto the eye and causing dryness. That clogged up, thick, will then cause the chalazion. And you can see another kind of picture of it. They're very painful. Some people get them recurrently. Some people will come in and they'll have one on the lower and one on the upper. And then I tell them hot compresses, digital massage, try to open that up and get that gland to flow. And 2 months later, they're back with another one on the other eye. And it's a miserable, miserable existence. So it's kind of all tied in together. Dry eye with that meibomian gland issue can be blepharitis, which can be just a very irritated, red, inflamed, kind of uncomfortable, burning, tearing, kind of miserable feeling of the eyes, and then leads into sometimes these recurrent chalazion. So so proper diet, this is what I'm saying. This gentleman that was my patient was miserable with blepharitis and changed the way he was eating totally into he went flat out carnivore and was just so ecstatic. I hope he's going to come to my next meetup. I think he's still following me on Instagram. So I have to reach out to him and see if he's coming to the meetup in July. So, all right. Let me just see. Oh, let me get to one other thing that I wanted to bring up regarding the meibomian glands, since I showed you where the meibomian glands all open out onto the lid, and then bring up the topic of the fact that, let me see where it is, I see so frequently women who do what's called tightlining, and they apply on the upper and lower, or just the upper or just the lower. Just trying to see. Yep, I think you're getting a good view there of their eye pencil or liquid eyeliner. You do not want to put that in that inner edge there. You can see it on mine. You want to keep that clear. When you put the eyeliner on, sorry for all you guys out there, but when you put the eyeliner on, it's going to be underneath the eyelash or over the top edge of the eyelash. You don't want to go on what they call the water line, which is basically that line where those meibomian glands are opening up. I look at that under the microscope and see this thick layer of makeup, and I cringe. That's a recipe for disaster. You can get away with it for a little bit, but not long term. That is so not good. And I see that in on makeup, you know, all the time, like just different places with like on YouTube, like how to apply makeup, and I see them doing that, and I just say, oh my gosh, that's so not good. All right, let me just look over here in the chat and see if I can pick up a couple questions, because I so appreciate you coming in and joining me live tonight. All right, any new info on using the carnivore diet and retinitis pigmentosa? Any suggestions beyond carnivore, red light therapy, sun exposure, etc.? Yeah, the tough thing about that is that, again, there's no money pouring in to do any studies to try to determine if any of this is helpful, especially when it's a free therapy. As far as sun exposure is free, eating a meat-based, animal-based keto carnivore diet, free. Nobody's making money on pills and supplements and vitamins. And that's the sad reality of research now, because everything is funded and grant money. Unless, like how Sean Baker has a GoFundMe and has raised a lot of money to be able to do a study. But that's only because to do a proper study does really cost in the millions. And but I have to say, of holding out hope of staying carnivore long enough, I got to believe that ancestral man wasn't, going blind from retinitis pigmentosa, and that it wasn't a normal disease of those times. So I always hold out hope that, pretty much anything like that is going to improve or halt the progression of with carnivore. I have a lazy eye only when very tired, so sleep cures mine. So that lazy eye is different than the amblyopic lazy vision eye that I was referring to. You're referring to either a exophoria or an esophoria, which is a turn when, if you get really tired, and some people have their eyes have a tendency to be exophoric, meaning outward aligned, and then you constantly have to use your ocular muscles to pull them in to see single. And for people whose natural position is far out, when they get really tired, it might end up going out. You probably see that in some kids sometimes too, but that's a different lazy eye. That's it could be an alternating exophoria, or just a large phoria that just needs good sleep to keep the muscle strong enough. And are there exercises to improve eyesight? There are some. There's a lot of different information about that. You can do what they call pencil push-ups, which is holding out, fixating, and following it all the way in, all the way out, and then looking far away, back here, in and out. Or there's actually apps or programs that have also movement where you're tracking and doing things like that. And then as far as the amount of intense up close that we do, on our phones, on our laptops, on the computers constantly and reading. There's a general visual hygiene rule of the 20-20-20 rule, which is every 20 minutes, um, look 20 feet away. How's that go again? 20-20-20. Yeah. Um, yeah, you have to take a break every 20 minutes and look 20 feet away for 20 seconds. That's it, the 20-20-20. So it's basically because there's muscles inside the zonules which are contracting to change the shape of the lens in our eye. I have a little eye model here. Um, this is actually showing a cataract, so I'll go over that too. But surrounding the lens, so the lens sits here's the clear cornea, then the iris, and then behind is the lens. It sits right behind the pupil, and there's zonules around it, and the zonules are contracting to squeeze the lens, which when we're young, it's soft enough to get the focus to be up close. So the thought is that when we are so contracted and focusing for so long that we need to release that, I like to actually go outside, go for a 10-minute walk and look out toward the horizon. And then that way you're getting sun also, because if you follow what I say as far as sunshine, it's so important to get sunshine into our eyes, and that you don't want to keep sunglasses on all the time when you're outside. It's so important. Aside from the photoreceptors of the rods and the cones, which are responsible for our vision, our eyes are part of our brain. It's actually connected through that optic nerve to the brain. And there's other retinal ganglion cells called melanopsin cells, and those are responsible for um, all the other parts of the circadian rhythm, our hormones, um, our accommodation muscle, whether our pupils are constricting in bright light or dilating. Because you got to think that's all being controlled by light, but not vision. It's not related to seeing, but all of these are inside our eye, and it sends messages to our pineal gland in the brain. And I just can't emphasize enough from everything that I research. And I'm like I'm fanatical about I've got a curiosity addiction. I just I'm like a sponge. I want to learn everything. And the more I understand about the sun, aside from the vitamin D on the skin, and there's so many other things other than just the vitamin D with the sunlight on the skin, but it's just so important. And then that brings up the topic. I've had a couple people write in, and I tried to take a screenshot of all the questions so I could try to get to as many as I can. But the question about contact lenses and sunglasses, there are quite a few contact lens companies that have UV blocking in them, and they're touting that as a benefit and a bonus and a plus that to buy that brand. And I'm saying avoid that brand because you want to get as much of the of the light energy from the sun into the eyes. Let me just see what I was. Tracy's writing in the chat here, has anyone else's vision improved since keto carnivore? Mine has improved tremendously, and she's 55. Yeah, so the thing with people writing into me as far as that, I've had a lot of testimonials that people's prescriptions have improved. I had somebody who was a -7 and 7.00 nearsighted. Let's just call that Coke bottle. They reduced down now to a 625, and I think they've only been carnivore like maybe a year. So just I'm not saying that everybody's going to be rid of their glasses with this. But I'm really hopeful that I hear more and more stories of that. Let me just keep going and see. I see somebody wrote, "Is it alcohol?" Probably referring to the bloodshot eyes. Hi, Tim. All right, Cindy Vonk, you're asking about the macular pucker. So really the causes of the macular pucker are, and actually that will bring me into, it's a good segue into the whole thing with vitreous detachment and floaters. I have a lot of people ask about floaters. Macular pucker can be a consequence of having a vitreous detachment, which a PVD, posterior vitreous detachment, so we just call it PVD for short. It's very common, and so common, the estimate is about 50% of people by the time you're 80 will all have had a PVD in one or both eyes. So a PVD is the actual vitreous gel that's inside the eye. As a normal aging change shrinks a little bit, and it can pull away from the back of the eye or the retina. So I'm going to show you, hopefully this will show up. So you can see here that that is pulling away. See where it's kind of flopping inward. Ugh, this kind of looks good at first. There we go. And then you can see this is pointing to little floaters, which are fibers that clump together. And then it casts a shadow on the back of the eye, which is what you are seeing as the floater is these, little clumps that are then suspended inside. And that's why when you try to look at them, they're kind of cool. They kind of move away as you're trying to see them. They keep moving in the same because they're inside the eye as you rotate your eye. Um, so no, macular pucker does not lead to macular degeneration. No, it's something different. And being the fact, Cindy, that I know for sure you do not eat seed oils, grains, or sugar and haven't for quite some time, I'm going to be pretty confident you will not be in trouble with macular degeneration. Um, let's see. Oh, so the other thing that I was going to say about the floaters is they will dissipate typically with time. And people ask, are they treatable? Um, for the most part, we leave them alone because they are just kind of a random periodic annoyance. Uh, they can do a vitrectomy, which is removing the entire gel of the inside of the eye and replacing it, but not recommended. There's risk of infection. There's risk of retinal detachment. They're not really going to be doing that. There is another procedure called laser vitreolysis, and that is laser kind of hitting at the floater. The floater really has to be pretty large and pretty obstructive to your vision before that is something that is recommended to do. So for the most part, you got to just look at it as just a nuisance and try to ignore it, shift your vision. And typically they will dissipate a bit over time. And I have actually had some carnivores who have reported to me that their floaters have improved after going carnivore for other reasons. Obviously, here's the thing: I can't have a patient come in and they say, "Doc, what am I going to do? I've got, all these floaters," and I'm not going to say, "Well, why don't you try this crazy fly your freak flag diet and see if it works?" Because nobody's given up pizza and pasta and all that for chocolate for for floaters just to see. Um, okay, I'm trying to I think I just saw somebody wrote in here about does false eyelashes glue or the magnetic liner cause problems too? All right, so Tracy, I'm glad you asked that because I'm planning on doing a post about that, but um, there are problems related to the we'll call them eyelash extensions and false eyelashes. It can lead to actually I've had some patients have problems with their own lashes becoming weak and kind of messing up their own lashes because of long term using those um, fake eyelashes. And I've had some patients who've had, even after a couple years of success wearing them, develop an allergic reaction and had very irritated, puffy red eyes that took a long time to improve. So in general, I know so many people use them without any issue, so I'm not here to, try to talk somebody out of it, but I am here to tell you that as an eye doctor, I have seen negative consequences of it. So, I'm not a huge fan of it. You obviously can see I don't use them, but I do. Oh, so one of the other things, I know I jump around a bit because I'm so excited to try to get to everybody's questions and things keep reminding me, but it reminded me now as far as the contact lens with the sunlight. Uh, I have seems like an unrelated topic, but I had people asking about the um, the drop called Vuity that is a newer drop on the market to put in your eyes to be able to see up close. And I'm not a huge fan of that. It's a drug that used to be used long term, but long ago for glaucoma treatment, and it works by constricting the pupil really tiny. And then how it works is that it's like a pinhole effect on a camera, and it allows you to see better up close. Only lasts for about 4 to 5 hours, but you should not be having that in your eye when you're driving at night because it is so constrictive to the pupil, and your pupils need to dilate wide in the evening to let more ambient light in. And there's also it's a host of issues with that I personally would never recommend that or would not do it myself. So I what I do, and I've demonstrated a couple times on my Instagram stories, but I happen to have perfect distance vision. So on my non-dominant eye, everybody's got a dominant and a non-dominant eye. Does not necessarily correlate with right-handed, left-handed, but I put on a reading prescription on my non-dominant eye. I put a contact, one that does not block the UV on my non-dominant eye, and I look down and I can read everything perfectly clearly, and when I look far away, I see everything clearly with the other eye, and it works great. It's called Monovision, and I'd much rather see somebody do that than put, a prescription med into their eye. So, um, what causes ocular migraine? I don't have pain with them. Yeah, so interesting. Ocular migraine, or what's called a scintillating scotoma or an ophthalmic acephalgic migraine, is I'm not I don't I've looked into it. I don't see any definitive cause that's ever really been something that I honed in on, say, "Oh, this is what causes it." I myself have them every so often. I had them first when I was 26, and then sometimes I would have 2 a year, sometimes I would have none for another 2 years, and then sometimes I would have 2 in 1 week. It's just no rhyme or reason. It's the same visual aura that people who typically suffer from migraines will get just prior to getting a migraine. So there are many of us who get them from time to time with no headache afterward, and lasts about 10 to 15 minutes, and there's no issue with it, and I still have not seen anything that has listed a definitive cause of it. Um, Somebody wrote glasses, Roxanne, glasses or contacts more recommended. Um, that's really kind of more personal uh, um, preference. I personally, because I want to look young and I'm 57 and I don't want to feel like I'm really having to rely on glasses all the time. So that's why I love just popping in my one reading contact and then I go about my entire day never having to dig for reading glasses and they're not on my head and they're put them down. You walk in the other room. I totally avoid that whole situation and I'm not wearing glasses all day. So for me, that's my preference, but other people don't mind glasses um, and so and as long as you don't have any contraindications to contacts, which if you have severe dry eye, or blepharitis, like it would have most people are are okay to go into contacts. Roxanne says, "Why do eyes get bloodshot?" So it's basically, well, it could be trauma, a virus, conjunctivitis, but the typical things of just kind of bloodshot eyes is dry eye, blepharitis, or allergies. So allergies really are usually itchy. And actually, that reminds me of somebody who wrote in and said, um, I have stringy goop and I have to pull it out of my eyes constantly. What would cause this? So that really is that sounds like some sort of um, chronic allergic issue, and I don't know without actually examining that eye, but itchy and mucousy are two hallmark signs of allergies. Um, So Sandy Crawford writes in here, my floaters have improved tremendously on Carnivore. When I slip, they come back with a vengeance. Interesting. Um, oh, Tammy wrote, thanks to you, I've discovered Monovision and ditched the readers. Oh, that's interesting, Tammy. I'm glad that you gave that a try. Through the years of fitting contacts, some people can be fit into a multifocal contact. Okay. I happen to have a slight astigmatism and it just works. Really, it works better for me just to do the monovision and I have no problem with it. I love it really. And you know how many times somebody, you're with somebody or you're out to lunch and they're like, you know, they're on their phone and they're like showing you a picture and it's like, gotta, it's everybody's digging glasses out, read the menu to look at the phone. And I feel like I'm, back in my 20s and 30s. I have no issue whatsoever. I can see everything up close and far away. So Peter says carnivore improves just about everything. Why not eyesight? Well, it does. Well, from a lot of the anecdotal stories that I've been having reported into me, it actually does improve eyesight. So I think it's a matter, and then you got to remember too. I don't know, depends on your age. If you're 50, 60 years old and you've had 50 years of eating crap, and now let's say you've got 5 months of eating carnivore. We're not expecting 5 months to reverse 50 years of garbage food. So it's patience, patience, patience. It's just, um, it's not going to happen, quickly. And that's why I tell people this is not a quick fix for anything, but it's a gradual, amazing journey to optimal health. I got to say, it's just, it keeps getting better and better. Uh, so Roxanne says tips for healthy eyes, sun gazing, question mark. Um, yeah, I look toward the sun and I strongly believe, and I, trust me, I've done a lot of research into this, but in general, the thought is 2 to 10 minutes during low angles of the sun. So within the first couple hours of waking up, when this or with from sunrise, 2 to 10 minutes looking out toward the sun. Now, I hesitate to tell anybody to gaze and stare directly at the sun because, you know, depending on, if you haven't been eating a healthy animal-based diet for a long enough time, I'm not so sure that that's a great thing to do. Even being out in the sun, like people see me out, out in the sun a lot on the beach in my bikini. It's just because I can spend a lot of time out in the sun. My skin isn't sensitive to it anymore. I've been carnivore 13 years, and I'm cautious. I don't stay out there for 3 hours. But looking out toward the sun, even on a cloudy day, even if there's trees and buildings in the way, look toward the east in the morning. That ultraviolet radiation that's coming in is healthy, and you want to do that. Again, I'm not advocating sun gazing because that could be like a whole nother meditative trippy kind of thing that somebody's talking about. I don't know, but no, just looking out really toward the sun, 2 to 10 minutes in the morning, and then 2 to 10 minutes towards sunset time, does a huge benefit to melatonin, sleep, circadian rhythm, hormones, emotional, mental health, so many things. We don't realize how important the sun is. And it's like aside from, all my ocular health stuff, I'm really an advocate of appropriate sunlight and getting people to understand you do not want to slather on those horrible toxic chemical sunscreens all over your body. You want the sun. You don't want to block the sun, and you don't want to. You also don't want to burn. So if you are somebody who's very fair skinned and has not been eating a healthy diet long enough, I'm not telling you to go out and, be a lobster. You just really need to be cautious about it, but it's really important to get sunshine. I say 2 to 10 minutes at a minimum in the morning, early morning, and late in the, at sunset, and then try to be outside at least 2 hours during the day. I know it's not always possible, but I shoot for that. Let me just keep going over in the chat just to see. Just looking at. I do suffer allergies, but I get like water bubbles in the corners, had them since a teen, and awful hay fever, carnivore 2 years, 55 years old. I do react to light. I need shades on in house on bright days. So, you mean sunglasses? Wearing them when you're inside the house on a bright day? That I find so unusual that your eyes would be that sensitive. It just doesn't seem something is just not right with that. Is there a modification of the carnivore diet you could recommend for someone who has trouble adapting to full carnivore? um, well, so the question is, what's the trouble, and over what period of time, and what have you been doing to, adapt? Um, Most of the time, people who have trouble, it's trouble giving up the things that they don't want to give up, which, could be anything from their coffee with the Splenda in it, the chewing gum, the Diet Coke, the desserts, the keto treats, and then they give up and they fall back and they say they have a hard time adapting. But are you talking about you go meat, seafood, eggs, and you end up with a lot of diarrhea? You're having a hard time adapting like that? I'm not really. If you could write in what maybe more trouble is the dry eyes in your case. Okay. Yeah. So I still say you got to stick with it long enough. Make sure you're getting enough fatty meat. Got dry eyes after doing carnivore for a week or two. Yeah, you're gonna just have to plow through that one. You're gonna just make sure you eat plenty of delicious, ribeyes and ground beef and eggs and butter and just keep going. You've got to give it 4 to 6 weeks at a minimum to kind of get adapted. And I always say, just plow through 90 days. I have a number of people who I know who have said to me, they said, "Oh my gosh, if I had given up when it was tough and things weren't seeming right, and had I not plowed through it," they think, "Oh my gosh, I never would have been able to figure out all of these amazing benefits, and that this is really what I should be doing." So, Mandy writes, "Sadly am agoraphobic. No daylight, so eyes suffer. Yes, bright light hurts." Yeah, so that's tough. I don't know, maybe you need to do, some sort of gradual light therapy with, like, a dimmer and just gradually try to make it brighter, use one of those, uh, lights that they use for, like, seasonal affective disorder. Uh Top 4, yeah, ribeyes, ground beef, butter, eggs, sardines. I still have never, ever in my life yet, I say yet, tried a sardine. Um, yeah, Amy, you should talk with Phil W. because your question here is about retinitis pigmentosa too, and you're saying, will a carnivore diet help stop the progression and or reverse it? So again, there's no studies. Nobody's pouring millions of dollars into studying and taking 1,000 retinitis pigmentosa patients and saying, okay, you guys, you're all going to eat meat, seafood, eggs, and water and go about your year and come back and let's retest your retinas and see if there's been a halt in the progression of it. Like there's no studies that's going to do that. All I can say is the best thing to do is try to group together. Like I said, I already know Phil W. I know Phil, I don't know if you're still involved with Rivera or MeatRx, but I know Amy, he's over there, and connect and maybe make a group of. There's Phil chiming in. That is why I stopped donating to the Foundation Fighting Blindness. I tried to push them towards natural studies, but they just wanted pharmaceutical. Yeah, that's the crazy thing. But you get it. Who's pumping out a couple $1 million to do a study when there's no monetary gain or advantage or reason to? It's like you get it. Everything is driven by money. Everything, whether it's either a supplement, vitamin supplement, some sort of synthetic product, or pharmaceutical drug companies. And the studies, they so cherry pick. It's almost like the people they're paying to do the studies, those people know they don't want anything but the result that they want to get, and then they can manipulate the data. And it's tough. It's just really tough. And that's why I just come down to the fact of my own self-confidence of, through a lot of studying, reading, and research, that I'm confident that this is the optimal way to nourish my body. And I trust that my body is going to bring me to optimal health, and it's going to heal anything and everything that's wrong and fight off diseases and viruses and bacteria, as long as I'm giving it proper sunlight, proper nutrition, proper rest. So Phil, you guys are awesome over here in the chat. Sardines aren't my first choice ever, but the nutrition is good. I know, I keep hearing about that. And so I keep thinking that I'm going to attempt them, but I'm thinking I'm going to open the can and kind of be turned off by the aroma. All right, we're running out of time here, so I need to I should go through look at some more of the questions, or else I'm just going to have to do a part 2. What do you think about that? Should I try to do this? I was almost thinking I could come on live once a week, every week, and just not necessarily, could be anything and everything questions. I just wanted to concentrate this one on vision because I get so many questions related to that. So I hope I answered. Oh, you know what? I was going to just briefly talk about just because a lot of people asked about cataracts. So um, yeah, I do feel that, again, just like the other categories of eye diseases and problems, that we should be able to hopefully halt or prevent the progression of. I'm not so sure, and I'm going to show you why. I'm not so sure once a cataract is at a certain point. So this is just trying to show, so this just an eye, the lens is sitting, that black hole is literally the hole inside the pupil, and the lens is sitting right behind that. Still not getting, it's getting too much glare. Um, so that is a type of cortical cataract. There we go, that got in there. Um, and I'm not so sure that's reversing. And then this is a different type of cataract. You can see it's like yellowish, brownish, orange. And pretty much all of these types of cataracts, I feel like once they're at that stage, I'm not sure. I haven't done, again, there's no studies and there's nobody who I know of, at least, who has come to me and said, "Oh, I had, grade 3 cataracts a year ago. I turned carnivore because of maybe some other reason, diabetes, and now their doctor is astonished and their cataracts are level 2." I haven't heard that yet. So, just like I was saying with macular degeneration, once it's scarred and gotten to a certain level of what we call geographic atrophy, where the tissue is atrophied, I'm not so sure we're flipping that around. Phil says, I had 2 cataracts. One I had fixed, and the other I'm trying to let time and carnivore fix. I think I see some improvement, but it is very hard to tell. Yeah, and it would be a real slow, gradual change. And so it, again, like you said, so it'd be hard to, you know, I guess each year at the eye doctor, you can see what the vision, if it's 2040, maybe now it's 2030, or it went from, 2030 to 2025, then you could definitely say that over time it's improving. Haven't been to the eye doctor since they started requiring masks. I don't play that game. Cool. um, Carl's writing, what's the best, biggest air fryer? I love my air fryer. I've had 4 different ones, and I feel like I'm a pretty good judge of, for me, it really has to come down to, they all cooked about the same. They're all pretty quick. But it's the ease of cleaning. I've had a couple where it's just, they had like a metal wire mesh basket part to it. I was like, mine's just so simple. I literally spray it out with hot water. I have a link in my Amazon store, which should be at the bottom of this. I think I have a link to it in every one of my videos. And I always go for the biggest one because I'm always big on overcooking and having quick grab leftovers for the next day or the later snack or something like that. All right. We are at the end of the hour, and I don't want this to go too long because I could end up getting on another topic and go for another 15 minutes. So thank you so much for joining. I hope you got a lot out of this. I'm so passionate to share what, at least, my experience has been, and that's really all I'm conveying. I'm not here to tell anybody I'm, right. I'm not here to tell anybody it's my way is the way, because there's so much conflicting information out there between the fruit and the honey and the organs and the this and the that. And I'm just here conveying my 13 plus years of experience. I feel so amazing. I have been so grateful to have found this way of eating, to relieved myself of my sugar and carb addiction. And it was a hard time of my life. And this has just been a game changer for me, and to know that there's so many others out there that have suffered a similar, scenario as I have, and to be able to form a support group and be able to give information about how this addiction works and how this carnivore way of eating is really healthy is just so really, rewarding for me in such a big way. So I love running the groups that I run. I love seeing a lot of my group members here in the chat. Thank you for joining in. And yeah, community is the opposite of addiction. And if you anybody's interested in joining in on a group or one-on-one coaching, I have information down in the bottom show notes too. So I hope you all have a really great night, and I'll see you at the next live.